Welcome to the Rights Track podcast, which gets the hard facts about the human rights challenges facing us today. In Series 6, we're asking if and how our human rights are threatened by the COVID-19 pandemic. I'm Todd. In today's episode, I'm delighted to be joined by Alison Brysk, Professor of Global Governance at the University of California in Santa Barbara. Alison's research focuses on the impact of globalization on human rights, violence against women, and international relations. Her work has taken her all over the world, and more recently, her interest had turned to the global impact of COVID-19 on human rights. So welcome, Alison. It's great to have you here on this episode of The Rights Track.
Great to be here. It's such an honor to contribute to this wonderful global conversation.
Well, you're joining us from sunny California, and I have to say it's a sunny day here in Nottingham, so we're sharing the sunshine. But I remember sharing the sunshine with you at the University of California in Irvine, I believe. We had a day conference in San Diego, and then we went to Irvine for the second day, and we were discussing terrorism and human rights. You very kindly co-edited a book with Gershon Shafir on how democracies respond to the threat of terror. And I was just reflecting on those 2 days, which were absolutely exhilarating discussion about human rights, freedom, open society, security, and those trade-offs, and thinking about COVID as an existential threat to democracies, but also just an existential threat, generally speaking, and how human rights might be compromised or, there are exceptions around human rights. And I just wondered what your early reflections in our conversation today are about how has COVID changed the conversation about human rights?
It has intensified some dynamics. One of the things I've been thinking about a lot is a concept that emerged at that conference called the citizenship gap. Gershon had worked a lot on the concept of citizenship, and I had worked on human rights, and we were trying to think about that nexus that is sometimes complementary but unfortunately, as Hannah Arendt worried correctly, that citizenship was ultimately the platform for human rights. And so those who were non-citizens, second-class citizens, and what we later called in another edited volume, people out of place, meaning both physically displaced but socially displaced, status displaced people. And what people are talking about vis-a-vis the pandemic is a real intensification of the citizenship gap and what some people call intersectionality. That is the incredibly intensified vulnerability of refugees, migrants, internally displaced people, pandemic patriarchy vis-a-vis women, and indigenous people and minorities having both the greatest vulnerability and incidence, but at the same time being subject to the greatest surveillance and mobility tracking that is where the health crisis is being managed in a way that is injurious to their full range of rights, not satisfying their health rights, vulnerable because of their chronic lack of social rights, and then the state response being to turn on their civil liberties rather than a more systemic structural approach. And the thing is that we're really markedly seeing this as a worldwide trend. I was just hearing things about Brazil. We have seen those horrible images in India of the internal migrant workers. We've certainly seen the people of color minority situation in the United States, the vulnerability particularly of Native Americans. So this is really a systemic global trend.
So there are a couple of things there that I wanted to pick up on. One is about vulnerable people and people on the move that you mentioned. So there's this whole debate about Biden's response to migration from Latin America across the border in the United States, particularly young children. And I think he was challenged at his press conference about a 9-year-old boy who walked on his own from a family in Honduras and came to the United States. Are you going to turn him back? That kind of question. And that's a case that's emblematic, I think, of what you were talking about. And the second element of what you said was this curbing of civil liberties. So the Blavatsky School of Government at Oxford University has this sort of government restrictions index where it's trying to come up with a metric, if you will, an index of how governments have restricted activity, both economic activity, social activity, mobility of people. But also, I think there's a worry about the restriction of rights generally, and the pandemic being used by governments in a way, much like the threat of terrorism was used, to curb liberties disproportionately to to the threat of what people see. What do you have to say about those two dimensions there?
Well, one of the concepts that has emerged in recent conversations that I've had is that we really need to go back to our fundamentals of human rights analysis of the interdependence of rights. Human rights are universal, indivisible, and interdependent. And we've sort of notionally acknowledged that, but the empirical interdependence is growing, and the sort of reshuffling of the privileged hierarchy of civil, political, social, and collective rights. So the people who are vulnerable, the people who are out of place, are usually chronically disadvantaged in social rights in a way that has been now securitized, in a way that has been positioned at that they are a threat, and where there is, I would argue, culturally and politically, a kind of manipulation to displace anxieties about the real threat of the pandemic, which states are not managing successfully. As far as the civil rights threat, I think there are genuine civil rights threats, but it is fascinating, though not surprising, that it's the threats to property, it's the threats to economic activity by those who are already privileged that are politically salient as a rights issue. We were chatting about the situation in California, the attempt to recall Gavin Newsom, our governor, who was fairly competent in his initial management of the pandemic, but he insisted on fairly strict lockdowns. And there were few sort of policing and surveillance kind of violations in that process, but it did impinge a lot on property rights and the rights of business. And that is where the pushback is coming, unfortunately. So that interdependence and that selective attention to certain kinds of rights over others. And again, I think we're seeing a rather worldwide pattern.
Yeah, and so the other thing that's emerging now is a raging debate about privacy rights. So I noted from the newspapers that Rutgers University is going to require all students to have proof of vaccination before being allowed back on campus. And in this country, there's a debate in the UK about whether you need a vaccination passport to be able to travel. What are your views on this idea about compelling people to have a vaccination and how that trades off against their identity rights? And one of the worries, of course, is that once you have this vaccination passport, you not only can prove that you've had a vaccination, but your medical details are going to be stored somewhere. There's going to be a digital footprint of your identity floating about that shows that you've had this vaccination. Does that cause any worries in your mind from a human rights perspective?
Yes, I want to sort of make a lateral move here and argue that it's really an indicator of problems, that is a symptom of problems in other kinds of rights, because we yield privacy in many, many ways. And you can only have those worries if you have a functioning healthcare system. So speaking from the United States, where there's quite an intersectional impact of lack of access to healthcare, even those who do have access, it's very chaotic. The Affordable Care Act is still contested. There's still these tremendous gaps and disparities between private sector and public sector healthcare. Public health regulation vis-a-vis privacy rights, civil liberties, equity is a real concern. I did see one study about differential access and impact in the UK itself vis-a-vis migrants, and particularly women of color, who have lost priority for certain kinds of health services vis-a-vis the pandemic and are being monitored in different ways. So in the small subset of fortunate countries, mostly in Europe and the global north, certainly we need to pay attention to that and think that through. But we can learn from models of previous historical experiences of managing public health crises. I think we can learn from, for example, the AIDS epidemic, AIDS, HIV. And there are global repertoires for managing access, managing privacy, managing surveillance and monitoring. But at the same time, we need to say, but wait a minute, most of the world's population doesn't even have access to those kinds of health services. And in terms of cross-border mobility, that disparity in health rights is going to be not only a problem at home, but a problem for mobility and a problem for access to employment, access to asylum, et cetera, right? If you don't have your vaccine passport, you can't go migrate for your job. You can't get out of a refugee camp or get across a border when you're fleeing violence. And at the US border, that is very much the situation. I would also say that there are sort of COVID champion countries, New Zealand, Taiwan, who not coincidentally are often headed by women and have adopted a very systematic and structural, but really democratically managed and civil society forward kind of approach to COVID, where, there are significant increases in state power, but they are vetted democratically. There are mechanisms, there are checks and balances, there are mechanisms for citizen feedback.
Let me just push you a bit on that, because you have this notion of the patriarchy and how that intersects with the current crisis. Could you say more about that? Your sort of your emphasis on where patriarchy comes into play in all of this?
Within feminisms, there are a range of issues from individual women's leadership and empowerment toward systematic and structural patterns of patriarchy, of disempowerment across, I argue in other work, my 2018 Struggle for Freedom from Fear, across production, public space, and reproduction, control of those areas and empowerment of those areas. And so things like family law, things like reproductive rights become patterns of women's employment. Now, what does COVID mean for that? And this sort of external system changing threat? I was surprised to find that even in the employment zone, something like 2/3 of essential workers, frontline workers, are women. And so even though biologically COVID is more consequential for men, the rates of infection of healthcare workers, we have data now from the US, from Spain, from a couple of other places that have been tracking about 2/3 of or up to 80% of the healthcare workers being infected with COVID are women. So even if they have a somewhat lower mortality and morbidity rate, there are more women affected. And in other categories of essential workers, we also, in terms of migrants, we have this tremendous flow of domestic worker migrants worldwide, some of whom have been trapped abroad, some of whom have been expelled from their destinations, and all of whom are much more exposed, dependent, sometimes dependent for their immigration status on their household employers, unable to take protective measures. So that's just production. In terms of reproductive rights, we've had marked regressions in reproductive rights worldwide in precisely the sort of populist authoritarian countries, and the United States wannabe, where they have taken advantage of the health crisis to limit women's access to abortion, including medical abortion, as well as even, in some cases, contraception. Poland has been trying to severely limit women's abortion access, causing migration to neighboring countries for that medical service. There have been protests in like 2015, 2016, every time they have tried to have these draconian limitations. This past year, they finally succeeded, literally under cover of darkness. And there were protests against public limitations. That's another dimension, by the way, of the civil liberties dangers of the pandemic, that, one's freedom of assembly, right to protest. And I will diverge a little bit more to say that I think the Black Lives Matter protests in the US the past summer show that one can exercise freedom of assembly without significant threat of infection. There were very few cases traced to those protests. By contrast, political rallies around the election where social distancing and masking were not maintained as a political statement did result in COVID surges and hotspots.
No, it's fascinating, and your statistics are quite shocking. I think it's important to stress for our listeners that this disproportionality of occupations that are predominantly held by women makes them more at risk of the pandemic, despite, as you say, the lower level of comorbidities and risk, generally speaking, than men. So that's one dimension. I think the other dimension I'd throw in here is violence against women. And so what we've also seen is an increase in domestic abuse, precisely because of lockdown, that families are stuck in their homes, not able to travel as much, go out as much, go to work from home, etc. And we've seen a marked increase in domestic violence against women. And then to connect that with what you said about freedom of assembly, we just had a recent case here in the United Kingdom of a set of popular protests around violence against women owing to the death of a young woman in London, allegedly at the hands of the police. And the police response, the British police response, is now being heavily criticized because the protests in Clapham were repressed and the irony was they had these incredible images on social media of women being handcuffed and being thrown to the ground and being arrested, etc., at a time when the protest itself was about violence against women. So there was a tragic irony to some of that iconic photography from just a few weeks ago. And your observation about the Black Lives Matter, other social protests, political rallies, and the differences there are quite stark, that it is possible to have peaceful assembly. I think the reaction in the UK was that under coronavirus lockdown rules, no protest and no assembly is possible, and therefore the police adopted a quite heavy-handed approach to that event. And again, that intersection of rights, the free expression, free assembly, and worry about violence against women became intersected with public health and quote-unquote securitization, if you will, to use the language that you use there.
I have equally shocking statistics across every region, and I want to refer your listeners to UN Women has tracked and written some very good reports that really do good work gathering partial data, projecting, because one of the things that we tend to hear, I work with a project called Woman Stats that gathers sound empirical data on women's status and conditions worldwide. And particularly on violence, we're always told that you don't really know, this is anecdotal, and that's just not true. We now have not only an estimated increase averaging 25 to 40%, right around 30% of an increase in 2020 of reports of domestic violence, which always, of course, are lagging behind the actual incidents. But we even have one in the United States and one in India, longitudinal tracking of domestic violence in contrasting areas of more and less severe lockdowns. And you can really see the differential impact of lockdowns on domestic violence. And of course, it's not just the lack of mobility being locked in with an abuser, it's also the lack of access to supportive state facilities, to clinics, to shelters, and sometimes even to communications. Now, I do want to point out that just as there are options in other dimensions, and I keep pointing to them because that's sort of my mode of human rights analysis, I'm always looking for options, best practices, while acknowledging the problems. So there are a few very creative approaches in, I think it's France and Spain. They have set up certain reporting mechanisms in grocery stores and pharmacies so that if women are able to go out just briefly to secure basic supplies, you don't have to go to the police to report domestic violence. You don't have to call the special hotline. You can be in the midst of other things and have a code or a way to report. There are also some mutual aid projects in a couple of countries where women's groups are finding ways to visit each other under limited circumstances so that there's a supportive person available to monitor and possibly get some referrals going. We need to keep searching for those kinds of modifications and adaptations of our responses to human rights problems.
Yeah, and these sort of alternative methods of notification are crucial because there is a certain, just going to the state and reporting something, it can be a quite, terrifying experience. So having those alternative modes of communication, I like the corner shop idea. This is a place where people normally go and gather, and to have coded language to be able to signal that something is terribly wrong at the one point when someone might be outside the home is absolutely critical. But I wonder if we could turn now our conversation just in the last few minutes that we have back to the state of California where you live. Now, huge state, millions of people, massive economy, but also very, very deeply affected by the spread of COVID. And I'm wondering, just from a personal point of view, what have you been reflections over the last year of how the pandemic has been managed? You made some allusion to the governor, in his original sort of response to the pandemic. But what's the state of play in California now?
We have just recently turned the corner on case rates. We have a color-coded rating system, and most of the major areas of Northern and Southern California have now gone down from the purple tier to the red tier, and some are even approaching the yellow tier, which means graduated reopenings and mobilities. I think about 25% of adults have been at least had one vaccine. There were tremendous bottlenecks and supply chain problems for the first couple of months. We were really struggling, and we were also struggling with prioritization of access. It was being done strictly on an age basis and not accounting for medical conditions. And healthcare workers were getting it, but not essential workers. Anyway, some of that has been reshuffled, and the supply chain has improved in part because of the Biden administration's efforts. And they've done some public-private partnerships to get better distribution, which is reflective of the patchwork nature of the US medical system. In terms of compliance with and even lockdowns, we have had pandemic fatigue, and that's become a serious issue. I regret to report that it's become a very serious issue around college campuses, and college campuses are sort of remnant hotspots for spread events. My own campus has been closed for a year, and we have reopened some labs, but we have done online teaching for a year. And part of the reason is that we keep reassessing term by term, and finding that we just cannot provide responsible distancing and circulation protocols given the low compliance of the student population. We've had elderly and more established middle-aged and middle-class populations are the most compliant with the distancing measures and having the most uptake on vaccines. We do have vaccine reluctance from 2 quarters, well, 3 actually. California is, in our language, a liberal, a mostly progressive, a blue state. However, there is a small but significant semi-libertarian kind of conservative tradition. Ronald Reagan came from California, you may recall. So there's that reluctance on that side. And there have been questioning of vaccines and mainstream science from that population, that demographic, for a while. You also have a lot of New Age consciousness, alternative medicine. And so sort of from the other side of the left, there are some people who are reluctant to receive the vaccine. But the thing that's of most concern to me, I was just seeing this, is, of course, California is one of the most Latino, Hispanic states of the US. Something over 30%, probably 40% of our population now is Hispanic. They have been the most vulnerable and the most affected by COVID for both sociological reasons, and people also tend to be living in crowded multi-generational households, essential workers. There may even be some biological greater vulnerability. We're not sure. And yet there seems to be reluctance in terms of the vaccine. Some of this comes out of a well-founded fear of some histories of, discriminatory and oppressive public health practices against minority populations in the US. There's work being done through Spanish language media, through community organizations. The good news is we do have a lot of empowered Hispanic officials. My own congressional representative, Salud Carbajal, is a very powerful member of Congress. Javier Becerra, our former Attorney General, has now gone to DC to be the Director of Health and Human Services. So the California Latino empowerment in key governmental posts, I think, will help to bring people into access and into an understanding of health rights, and to make vaccine access conceived as part of health rights, and shift the conversation on that. So rights framing, I think, is often helpful in managing public health and other security crises. And that's some sort of circling back to the beginning of our conversation.
Absolutely. That rights framing is critical. And just thinking about the state of California, the population size there is more than 50% of the United Kingdom. The geographical size of California is much bigger. Just the complexity, diversity, logistical challenge, as well as the political patchwork that you painted for us really highlights the difficulty. And so when you see raw numbers coming out of the Johns Hopkins COVID monitoring and auditing statistics, it hides some of these complexities. And I think you've really given us a wonderful portrait of those complexities from a gendered perspective, from an ethnicity perspective, from a political and ideological perspective around vaccine reticence, but also a generational question in response to lockdown procedures, social distancing, wearing masks, and the vulnerability of certain areas like university campuses, but not exclusively so, where the progress of the pandemic ebbs and flows across these many, many dimensions, all of which are wrapped up by human rights concerns. So I think we've traveled a long way in our conversation today, and I really appreciate your time with us today. I think you've given us so much to think about in terms of the complexity of this, the interdependency of human rights, the mutually reinforcing nature of those human rights, and the continued importance of the human rights frame, as you say, for understanding the problem itself, but also finding solutions to getting a pathway out of the pandemic. So thank you ever so much for being on this episode of The Rights Track, Alison. It was a great pleasure in speaking with you.
Thanks for listening to this episode of The Rights Track, which was presented by Todd Landman and produced by Chris Garrington of Research Podcasts. You can find out more about the podcast at www.rightstrack.org. Funding for this series comes from the Economic and Social Research Council. Don't forget to subscribe to our podcast to access all forthcoming episodes and our fantastic back catalogue of 5 series of sound evidence on human rights.